Today, it's another takeover from Dr. Kish. Will you just give me my damn channel back?
Hi YouTube, my name's Dr. Kishan. I'm one of the cosmetic doctors at the lovely clinic. I'm here today with Jay, who's an expert on anti-aging for men, and you can follow him on his own YouTube channel, 20 Years Younger. So we're collaborating with Jay because Jay's interested in some of the anti-aging treatments that we offer. But as ever, I'm going to start with his perspective and perhaps some of his goals for treatment. And we'll work through a sort of a top-down strategy of looking at his face and seeing, we're trying to identify areas that he might want to improve. So Jay, how are you today?
I'm good. How much time do you have? I was just going to say.
Well, I'm going to give you the iPad, and perhaps if you highlight for us what you are most focused on.
Okay. So here and here. Okay. Just under my eyebrows, I have this skin which is kind of a bit saggy. So it kind of, I don't know, the word is not hang, but it's just kind of saggy. And it kind of makes me look a bit tired. That's the first thing. Mm-hmm. The other thing is just volume loss here and here. Mm. I've had a bit of filler a couple of years ago, but I would quite like to, you know, have something there. The last thing, you can't really see on this photo, but it's kind of around my neck. It's kind of like the skin is slightly saggy here as well. Just really slightly. It's probably only me who can tell, but these are the main things that I'm thinking about.
Okay. Well, I think what I was going to say is you've got a really good facial structure here, and the jawline is really, really sharp. It's very defined. But there's always, in men, I think there's always room for a little bit of improvement in the jawline, particularly. So I'm going to highlight a few areas if you don't mind. So I just noticed there's a little bit of mimic line here and across the forehead here. There's a little bit of volume loss here. And also around the temples. Now you can't really see it very much in the picture, but just here there's a little bit of volume loss, which would give more support to the brow. And I think that might even lift that area that you're concerned about as well. You've got really nice sort of cheek structure here, but just a little bit more to make up for what we lose with the natural passing of time. So that's probably what I would start with. And then you've got quite a prominent chin, but you've also got the beginnings of what we call a labiomental crease. And again, I think...
A mental crease, did you say?
Labiomental crease. So the lip to the chin, between there's that line here. And I think just if we can try and soften that, that will give a bit of nice structure to your cheek skin as well. And I agree with you, putting a little bit of volume in this zone will help as well. Okay, so we've done with the front-on view. Why don't we have a look at the side-on view? Okay, here we go. So again, I'll hand this to you, and perhaps if you point out anything else that you found that you'd like to improve on.
It's difficult because you don't see yourself side on, but I would definitely say this here is kind of part of the filler. I'd like some filler here, this kind of area. And the other thing I can see from this, well, I can see here as well, this is exactly what I'm talking about, just there, where this skin kind of hangs down here. And the other thing I've just noticed here is this, I have this little scar here that was a...
Ingrown hair.
Yeah, I had an ingrown hair, which I just removed, but then I had this scar here, so that doesn't bother me that much, but if there's anything you can do, that would be great. And then this was the other thing I was talking about just here, which is kind of a little bit saggy.
Okay. So I don't know if you noticed, but I mentioned to you in the last picture about your temple. And I don't know if you can see there, but that sort of, there's a sort of a shadow and then a bit of change in the way the light hits.
It's like dimpled, isn't it?
Well, dimpled, it's also a little bit flat, a little bit depressed compared to that nice smooth forehead. So I think that will again help the brow area if we try some filler here. I agree with you, as we looked at in the last one, a little bit of filler here will help restore the volume. Here we can try a little bit of subcision. So by subcision, I mean we put a needle underneath that scar, and that will break any fibrous attachments that the scar will have to the underlying tissues, and that will allow the scar to come up a little, and we can even try a drop of filler in there to help smooth the surface out. It's not a permanent solution, but it's actually dealing with the root cause of the scar being depressed. So if we can release it, that might help it. And here, although on a front-on view, you've got a very strong jawline, I think if we can sharpen that a little bit more, with a little bit of filler in this zone, that could help. And also, like we mentioned, a little bit in the chin, in the mental crease there. That might just stretch out the tissues here as well.
Oh, that would be good as well, yeah.
And one of the other treatments that we do at the Lovely Clinic is some fat dissolving injections, and they have a side effect that they also tighten the skin. So
what's the side effect?
The side effects. It's the treatment is that it dissolves fat with an injection, but the side effect is that it tightens the skin as well.
Right.
So that may be an option for you in treatment on that day. We'll just see how much time we have, what we can get through. We might as well do as many treatments as we can. So I think that's how I would do things. Lastly, we've got a picture with you smiling. So let's have a look at that and see if there's anything that bothers you about that picture. There we are. Anything here that catches your eye?
I see these kind of lines here, but these are just natural, aren't they? They're just, as you get older, when you smile, you do have this. So, you know, it's better to have these smile lines rather than frown lines, I guess. You know, it means you've had a happier life and you've laughed more. So, I don't know.
It's a very healthy way of looking at things.
Yeah, I've never really examined myself smiling that much before, but looking at this photo, my lip has disappeared completely on the top along here, which is a bit weird.
That's what I was going to mention to you. So we've looked at all of the other areas of sort of volume loss, and you've mentioned certainly here, and sort of in the lateral cheeks, just here, which we're going to sort of try and sort of soften for you. But yeah, your lip, even when at rest, it's and when we are sort of going to try to revolumize the rest of the face, I think the lips might be a little bit out of proportion if we don't give some volume there.
Yeah.
So perhaps we won't give you a trout pout or a duck lip, but but perhaps some really subtle sort of lip rejuvenation, some subtle.
My only question would be that the filler in lips doesn't last as long as a filler in the cheeks. So does that mean as the lips would dissolve quicker, would that look a bit strange that it would still exist here and here, but it wouldn't exist here? So does that mean it's going to kind of, my lips would look too small? Because you're doing this to kind of balance the face, isn't it? That'd be my only question.
True. So that's one thing. I mean, what we're going to do for what we're scheduling in is as much treatment as possible on that day. And then as things, because what you'll find is different fillers and in different parts of the face will degrade quicker or slower over time.
Yeah.
So then it will be up to you to maintain the treatment.
Yeah.
As and when.
Okay.
That's the way I would do it if I were you.
Okay,
and then the other thing I just noticed is, as you said, there's a few more lines on this side compared to that side. Perhaps if we try a little bit of Botox just here to soften that side a little bit. I don't know if that's something.
The word Botox terrifies me, to be honest. I'm not sure about Botox.
What terrifies you?
I'm terrified of looking like certain film stars or newsreaders who are, you know, like this.
Okay.
They just have no expression, and I know that's the eyes and you're talking about this, but I don't want to lose the ability to look happy and natural and smiley. So I don't know how strong it would be, but
so what I might suggest is if you agree to it, then perhaps we do a very, very small amount of baby Botox or microtox, just to perhaps even out what we're seeing on that side. So there's creating a bit more balance. You'd still be able to smile, you'd still be able to show expression, but just so that we try to achieve a little bit of symmetry when you're smiling.
So
nothing more.
Botox, is that like a diluted
much more
Botox?
much lower doses of Botox.
Okay.
So nothing to freeze you, nothing to sort of prevent you smiling.
Yeah, that sounds okay.
Something worth a try.
Yeah.
And it's temporary as well. So if you don't like it, the effect will be gone in 4 to 6 months.
Fantastic, yeah.
So we've got a rough sort of treatment plan. Do you have any other questions, any concerns that you might want to check in with me about before we...
Just the Plasmage, it's really just the recovery time. You said it's about 10 days. So I'm really thinking about, 10 days taking that time off work, or, trying to organise not to go anywhere, or, how obvious is this going to be? And that's my kind of fear about that.
So the internet's literally full of these pictures of people's eyes after people have had treatment with blepharoplasty. So plasma is where we use a particular energy to vaporize islands of skin tissue so that we get a nice tightening of the upper eyelid. Now, I was taught that it takes 2 weeks for the tiny carbon crusts that are formed to fall off. Okay. But in my experience, no one's had carbon crusts that have lasted longer than 1 week. You do get very swollen, your skin does become very red, but the redness you can hide. The swelling, we usually give you a medication on the day to help bring the swelling down. And the carbon crusts, there's not much you can do about them. Okay. But as I said, they tend not to last that long. So they're with you for maybe about 7 to 10 days on average.
And then you can more or less walk around the street and it's going to be...
Yeah. Okay. And if you wanted, you could use a little bit of cover up, maybe to take the redness out. The main thing is to stay out of the sun so that you don't develop any pigmentation in the areas that's been treated. Okay. But I would take off some time off work, especially if you're dealing with the public. And what you can do is you can just come back to work when the crusts fall off. Okay. Yeah. Any other questions at all?
At the moment, no.
Okay, great. So we've got a plan. We've got a rough plan, and why don't we see what we did? So we started off with John, who wanted the most subtle and the most natural looking appearance. And in fact, we took quite slow baby steps with him. We started with Botox in the eyes and in the glabella complex as well. So we're using very, very small amounts of Botox. I think we use less than 40 units in the end to give the most subtle wrinkle reduction in these areas. As you can see, I targeted the muscles that contribute to those fine lines that develop on smiling and on frowning. Then we used Vital Light in the middle corner of each eye to give us a little bit of a lift and a little bit more of an awake look. And here we used Define from Restylane with about 1/4 of a syringe in each temple to give a more lifted and softer look to the brow. As you'll see later on, this also gives a bit of support to the eyebrow as well and makes even the eyelids look a little bit more lifted as well. We went on to the eyelids next with the Plasmage treatment, which vaporizes islands of tissue in the upper lid and contributes to a tightening effect and also stimulates collagen regrowth as well. And you can see me just zapping the area and vaporizing very, very softly the upper eyelid. And here we're using Volux in the jawline, and we're using almost a syringe each side to create definition and contour to build that jawline appearance. And here we used Ultra 3 from Juvederm. We're using tiny, tiny amounts. We're using less than a syringe, so we use 0.05 ml in each lip quadrant to give the most subtle, natural looking effect, which is what Jay wanted. And we used a cannula for this approach as well. We're back with Jay from 20 Years Younger, who had treatment with us 1 month ago. And we're back to find out his thoughts and maybe your ideas about what went well for you.
Yes, so I'd say first of all the temple area where I had filler, this made the biggest difference. It kind of gave my face a healthier shape. The jaw made a huge difference as well, just kind of making my jaw squarer. And under the eyes as well, kind of got rid of some hollowness under there. So they're the 3 biggest things that I've noticed, and other people as well.
Great, okay, so you might have had some feedback from people that you know. Because we tried a few new things for you as well, because we tried lip treatment, we tried temples, which you liked, and we even tried Botox for you as well. What do you think about those new things that were...
So the thing is, this is the first time I've had so many injectables in my face. So I was very, a bit hesitant, and I was a bit scared of having a, crazy, trap out or something that looks really unnatural. So I was stressing that I didn't want to go too far. So the look that I have is very subtle. So it's not like anyone will look at me and think, oh wow, something's different. So the lip fill I had, it was 0.5. Was it 0.5?
That's right. It was a really small amount. It was like 0.05 mil in each lip quadrant, and we did it with a cannula, like for the most subtle, softest effect. Yeah. And I think even with that at the time, because of the swelling,
I freaked out.
Jay was a little bit worried that it would be too much. But as you can see, it doesn't look unnatural at all. Yeah. Especially now. I think we were saying before that you might even have a little bit more next time.
Yeah. It was so subtle that. It goes to show what a good doctor you are, because you knew exactly how much to put in and what it would look like after the swelling, so you kind of could foresee what it would look like. So yeah, lips were really subtle. The Botox, again, you didn't use a normal dose because, again, I was scared of looking a bit frozen or unnatural. So it's not a huge difference. When I smile, I can definitely see there are less lines around here, but it's what I wanted. It's kind of, it's mobile Botox, I think it's called, isn't it? So
microtox.
It's not a full-on injection. So
baby stops for baby steps, basically. Yeah, it's perfect.
For baby faces.
Yeah, exactly. The other thing we trialed was Plasmage, which is a treatment to reduce some of the redundant skin that we start to develop as we get older in the upper eyelid. So this particular treatment is called blepharoplasty. It's hugely popular because it's although there's a little bit of downtime involved, it gradually tightens and creates collagen in that very delicate area around the eyes, and gradually it leads to a much more awake look. So I suppose when we looked at your pictures before and after, we saw a little bit less lid show and your eyes looked a little bit more awake. Don't know if you noticed that so much now.
Again, it's subtle, and I think as it's still working and as it's still lifting and the collagen is kind of growing, I suppose, it's something you will notice more and more as time goes on. Yeah. So that was uncomfortable, I've got to be honest. And my eyes were completely swollen that night and the night after. And on the third day, it kind of, the swelling went down, but it was red, and then you had the scabs. So if someone wants to have this, I think you need to take, I mean, as a guy who's, you know, because women can hide it with makeup, potentially. As a guy, if you're going to have Plasmage, I'd say take a week off work, and then you can relax. You don't have to worry, because I was literally like going back to work on the Thursday, and I was like, oh my God, is it going to be okay? Am I going to have to take a day off work or wear sunglasses or something? So yeah, I'd say a week, and then you can relax.
Sensible advice. Why don't you tell us a little bit about any downtime you had, any problems with healing maybe after the treatment? Because we still had quite a lot in one session.
It was a lot, yeah. I think with the fillers, depending on the area, like with the jaw, it didn't swell up until the third day, which was a bit weird because I thought, because everything else was swollen on the first day. So it took, I suppose, about 4 days for everything to go back to normal and my lips to feel normal, because it kind of feels like you've got something in your lips. So I'd say 4 days. But the filler wasn't painful. That was just slightly uncomfortable, especially when you're trying to sleep and you're laying on the pillow. But it wasn't like, you know, the swelling that I had from the Plasmage.
Okay. And I suppose going forward, what do you think you'd like to focus on now, like it's in this sort of journey? Because we didn't finish everything that we wanted to in that session, did we?
Yeah, the original thing that I wanted was to have the acrylics, is it? Which is kind of fat dissolving under here. So we didn't get time to do that, but I'm still interested in having that. And after seeing how natural this can look, being done by yourself, you know, not some random person on the high street, I would be more happy to maybe have slightly more lip filler. So yeah, I'm open to future treatments as well.
Yes, so I was just going to say that Jay's facial proportions are such that he can take a little bit more volume in the lips. And I think it will look quite...
take it.
Yeah, exactly. And I do think it will look quite attractive. So this is one of those situations where we're not trying to prevent aging or turn back the clock 20 years in your 20 years younger program. We're trying to enhance what features you already have and making just a slightly more attractive version of yourself. So that's certainly something we can look at when you come back. One of the things that I was going to suggest was that we try perhaps some high focused ultrasound in that region, as well as the fat dissolving injections to tighten that area further. Because the other step beyond that is surgery. And that's quite a big step to take, as most people would agree. Whereas with this, it's a gentler sort of approach to tighten the jawline. But I think if we look at the angle of the jaw and also sort of the shape along, it's a lot more defined. And that actually stretches out that little pocket of fat as well, a little bit. But these are all very subtle things that I think are in keeping with what you wanted to stick to in the beginning.
Because I have had radio frequency, but I think you said that the... what you're talking about now
that's
is actually
skin tightening.
Yeah, that's skin tightening, but this actually goes from underneath the skin, so it kind of lifts everything up more than the
So high intensity focused ultrasound or ultracell or Althera. These treatments target a fibrous tissue, an anatomical layer underneath the skin, which gives a much more tightening effect, much more lifting effect. Okay. And that's something we can also look at in the clinic for you.
Yeah, sounds interesting.
Okay, guys, thanks very much for watching. We'll be back in 2 weeks' time with more excellent patient treatment videos. Check out Jay's YouTube channel.
20 years younger.
And if you've got any questions or comments for us, pop them downstairs in the comments box below. And for now, we'll say bye-bye.